Hi, I'm Jennifer Nunes and I'm a registered social worker. I have a master's from University of Toronto and I have an undergraduate degree in social work as well as an undergraduate degree in gerontology and health studies from McMaster University. For the last 7.5 years, I've been working in clinical settings. So I started off working in acute care hospitals where I helped with families managing healthcare crises. So whether it was a stroke, orthopedic injury, post-surgery, I would do sort of the assessment piece for the patient as well as helping the family to process what life is going to look like when the patient returns home. I then moved on to long-term care or long-term rehabilitation hospitals where I helped patients and their families deal with the new norm of what life is going to look like after a life-changing illness or an acquired disability, as well as discharge planning back to the community and arranging services for them at home. That actually took me to a bit of a career change where I started working directly with children and families for a local school board, where I continue to work part-time today. My work there is with students from basically kindergarten all the way to grade 12, and I help navigate the healthcare system for parents, provide consultative support, resources, psychoeducation, as well as clinical counseling for students that are experiencing any kind of challenge in the school setting. So whether that be learning differences, most of the time it's a mental illness or challenge, social skills building, relationship challenges, things of that nature. And I love my work. About 2 years ago, I had a personal experience where we almost lost my youngest child to a medical crisis. And that actually inspired a tremendous amount of growth and change, not just personally, but professionally as well. I saw firsthand the gaps in the healthcare system and what was not available for children and their families, and I realized that that was an area that I really felt like I could contribute and help. That brought me to Accendus, where I've been for about a year. I work with youth, children, and parents to help cope with changes in life, whether that transition is a divorce or separation, bereavement and grief, somebody living in the family with a healthcare issue or other trauma, because the reality of it is when one person experiences a trauma or a transition or a challenge, it impacts the entire family. And we're here to help. I love what I do, and I really feel like it's an honor and a privilege to get to be a part of such a transitional and formative part of somebody's life. And so I really feel like my role is to hold space for children and parents to figure out what the new normal is going to look like, how to navigate an unknown world. What does this life of change look like, and how are we going to figure it out?